For those of you who haven't met me, I am a self-professed Qlik dork. I'm also a self-professed data dork. And I got to tell you, after 10 years in the provider space, working with payers these last couple of years has been very refreshing, because my struggle prior was we don't have enough data, we can't find data, we can't answer our questions because we don't have data. And so being in the payer space where there's an abundance of data has been great. It's been kind of a trip for me as I look at these glossed over eyes like, well, what are we supposed to do with it all now? Now we've got all this data. We don't know what to do with it. And what I'm going to propose is that I believe one of the best ways to see data in a comprehensive view to make a case is with geospatial analytics. And so I'm going to walk through some mapping, and I am not proposing at all that the mapping is the only possible way you can visualize data. What I am going to suggest is that by looking at things geospatially, as we add layers in, we can start getting pictures that we would not ordinarily see for tables. I think that I've got proof from my viewpoint because John Snow copied off of me back in 1854 and solved the cholera problem by using geospatial analytics. So therefore, I think my idea has been proven true through history, especially for population health. So those of you who have not seen any of our Qlik geoanalytics videos or demos, I want to just start you with some interesting ways. So what I've done is I've taken some social determinant of health data. This is the CDC social vulnerability indicators. And what this does is it's got numbers based on either census tract or counties, and I've loaded in every census tract for the state of Georgia. And so I'm looking at this data. Traditionally, I could use a bar chart with some nice coloring. Ooh! And I can see the variations across every single census tract. Wow, that's so pretty. The problem is I could view it that way. I could look at it in a line chart to see how it's changed over time, blah, blah, blah. But that doesn't give me a picture of the state of Georgia quite like a map does. So visualizing that same data in a map gives me another picture. And so if I were to try to pick a factor like income, or I pick a factor like show me people who've lived in multifamily housing units, or let me see the population. When I see it graphically like this in a geospatial form, it gives me a different story. And that's part of the whole point, is as I begin consuming things this way and I see where, not just numbers, that makes a difference. So I'm transferring from what the numbers are to where those numbers apply. So as I look at Georgia, it should be no surprise the population is huddled around the city of Atlanta. That should not be a surprise to you. What I like to see is that same thing for the states where your members are located. Like anything within Qlik, a geomap would interact the same way that everything else would. If I filtered to some census tracts, I would expect the mapping to show me just those census tracts. Just as I would expect if I click on a census tract in a map, I should filter to that census tract. When I start dealing with mapping, it's not just picking and choosing. I could also use a lasso to pick a complete region within the state. So I'm looking at all of those census tracts. And so that's just bare bones, right? This is just, hey, this is just like any other chart. It just gives us a different picture of where these things are. What really comes into play is when we start now combining that with other data and we begin adding layers, because it's not just about visualizing a pretty picture. It's where do my members live? And the nice thing about this is as I add in where my members live, I begin to translate from seeing just where they live to how they live. I've got an immediate picture here of how many of my members live in a very highly populated urban area versus those that are living in very rural areas of the state. And if I were looking at income or limited English speakers, I'm seeing how my members live, not just where they live. But this idea of layering is just the beginning. We would expect to be able to see more than this. Again, this is bare bones for those who are just kind of getting introduced to this concept. I wanted to keep things simple. And so, yes, I can have the layers. I can see the data for population or any population health I want to look at. If I wanted to look at other information, I can consume any of these external sources. I can see my members, but hey, you know what I like to do? I like to see where the hospitals are in the state of Georgia. You know what I like to see? I like to see where the urgent cares are in the state of Georgia. You know what I like to see? I'd like to see where the pharmacies are. And so I can continue adding these layers and plotting these points because now I've also got some other information. I can see, which members live close to a hospital, which members live close to pharmacies, which members live close to urgent cares. Hey, let's add layers for healthy food stores. Hey, we have affiliations with multiple gyms in the state of Georgia. Can we plot where those gyms are so that we can see which members live within some reasonable distance of those things? Now, if I were to continue to zoom into here, I could figure out where roads were, and I could see things, blah, blah, blah. I am not expecting you to go onto the screen, drill down, and you try to figure out with your thumb, how many kilometers am I from something, or how many miles am I from something? Is that reasonable? One of the things that we can do is an analytical function for layering and for travel area. So instead of looking at just that hospital's plotted point and figuring out, well, are they close enough? Are they close enough? And guessing, what we can do for you is take that latitude and longitude and then determine some number of minutes or miles around that point. And so what you see here is kind of the polygon of where I can travel from that point in X number of minutes. And what I've done is I've just predefined 35 minutes. So this is 35 minutes around the hospital. Hey, if you could do that for hospitals, can you do that for urgent cares? Of course I can. And what I've done is 20 minutes around the urgent cares. And what you're seeing here is it's not a perfect concentric circle because this involves roads, right? So I've got to be able to get from this on a road to somewhere, and so maybe the road is either slow or there's no road this way. Maybe the highway goes around, and so that number is not within that 20-minute drive time. And so that's why you're seeing these oddly shaped polygons, because it represents the time that it would take using standard stop signs and road speeds or highways that are available, or the fact that there may be no road from here to there that connects. You'd have to go all the way around things. And so I can continue adding these layers in. Again, I could have information on a screen in a bar chart. I could have things in list charts. I could have all these different spreadsheets with all of this stuff. I could let you print a map. You could take a ruler. The more layers I begin putting on this map, I think the more story that you get, right? Because you're seeing a proximity to things. You're seeing how they live, how close they are to things. Oh my goodness, I know what you want is more, right? As I calculate these areas, you say, hey, that's phenomenal. You use 35 minutes, you use 20 minutes, you use 15 minutes. Come on, that's so ridiculous. Clearly, we need 40 minutes. Our organization uses 40 minutes as our determining time, and we want 25 minutes for urgent cares. But you know what? We want 12 minutes for pharmacy areas. Maybe for whatever it is you're doing, you don't even want to use minutes. Maybe you want to use miles. Maybe you'd like to do it as the bird would fly and not worry about roads. So all of these things that go into calculating these travel areas can certainly be modified. What I'm going to do is I'm going to go ahead and I'm going to tell it to reload this. What's going to be happening here is you're going to see that thing spinning off. It's doing some work. It's taking some time. And what I wanted to do was just give you an idea of what's going on. While this thing is spinning, what's it doing? And so rather than just watch it spin, I want you to understand it's calculating those travel areas. Again, it's trying to create a polygon on the fly, looking at all the roads, the conditions of the roads, the normal speeds, blah, 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 for hospitals, urgent cares, and pharmacies. You can see that it finished now, but I'm going to finish my story. So it came back in time. What it does beyond and above that, I'm going to show you in a second. It takes the intersections then. It looks at the polygons for those census tracts or for those counties or for those zip codes that you may have mapped, and there was populations or there was information. I want to figure out, this is crazy, the area under the curve for all of these things that intersected. I need to know what's going on, where they had. Hey, if I can figure out that polygon, can't you count the number of members for me? Yes, I can. I'm going to show you that. Hey, since I've got these locations, if you can figure out polygons and you can figure out travel areas and within, can't you show me the fastest routes for the members to those locations? Yeah, this stuff is truly that kind of powerful. So I'm going to get rid of this again. This did finish. And so not only am I now showing the updated areas for these, but it's saying, hey, by the way, the total population in the state of Georgia is almost 10 million. About 8.4 million of them are within range of a hospital. That's overall population. Just give me a picture of the state of Georgia versus my members. I've got 279 members that are within the drive times of those locations, and 209 are not. Well, if I can use it to calculate that, well, then why would I show all my members in blue? Because now I can actually color based on that. These members are at risk. These members are within my area. Whatever that might be, whether this was proximity to pharmacies or whether this was proximity to healthy food or recreation, whatever it is that you may be looking for, yes, we can absolutely do that for you. We can then add all these layers in. We can color the map, but you can also have these metrics. One of the things I thought would be fun while we're doing that is not only do I have to do these KPIs, you could use one of our text boxes to take that same information and create a story. Hey, by the way, boss, the state of Georgia has a total population of this. This many people are reachable. By the way, in regards to our specific members, we've got 488 in the state of Georgia. 279 live within our targeted travel time. 209 do not, and they are at risk. And blah, 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 blah. Whatever other stories I need to tell, I can figure that information out geospatially. One of the things that I thought would be cool, because there have been some questions from others, is I can calculate all that. Can you show me routing? Well, absolutely. What I'm going to do is I'm going to pick a specific member, and I'm going to show you their routes now. And so the closest 3 hospitals for member ID 14, whenever I might be on the phone with them, these are their closest 3 hospitals. I'm showing the route that is within the travel time in green, and you'll see that I can hover over routes and get information about that route. This one takes 38 minutes. It's also in green. This route is 55 minutes. And so, yes, we can actually calculate routing as well. So the purpose of all this, again, it's not that mapping is just another way to do it. We've been doing mapping since 1854. The beauty of geospatial analysis and using Qlik's geoanalytics tool is that we can help find out members who are at risk. As we do these population health initiatives, we can bring lots and lots and lots of data together to give us that comprehensive view in a way that more likely jumps off the page than a whole bunch of spreadsheets, a whole bunch of bar charts and list boxes and tree diagrams. It's about giving us information about where and how our members are living and who may be at risk.